Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And today with me is Dee Bell. Welcome, Dee.
Hi there.
It's wonderful to have you. You are part of our tongue tie symposium of 2025, and you are bringing a wonderful presentation titled Beyond the Frenulum, the critical role of skilled feeding support in tongue tie management. I'm really excited about this topic. But before we jump in there, I want to learn a little bit about you. You are a fellow midwife, an IBCLC, and a specialized tongue tie practitioner. You wear so many hats. Tell us a little bit about your background and where you are in the world.
Yeah, of course. I'm from Brighton in the UK, and I have two clinics, one in Tunbridge Wells and one in Brighton. I see families in the clinics. I also do home visits. So I started my journey as a midwife back in 2000, which sounds like a very long time ago now. So I've been doing it a fair while, and I went through working on delivery suite, working postnatally, and had a passion for breastfeeding. I took my IBCLC for the first time in 2008 and became a tongue tie practitioner in 2009. So I've been recertifying with my IBCLC. I think I'm them 3 times now, coming up for a 4th time. And I went into private practice in about 2015, where I could kind of give more holistic, more family-focused support.
Wonderful. Thank you for sharing that. I know you also founded the Infant Feeding Academy, right? Tell me a little bit about that. What do you do there? And this is specifically also for healthcare providers, right? Or
Yeah, absolutely. So it's for anybody working with new families. And basically, it came about because whilst I was in the NHS, my role was as the infant feeding lead, and I was providing training for, maternity support workers, anyone within the hospitals, so doctors, midwives, sometimes health visitors as well. And I saw the massive gap in education. Some people were reserved about wanting to have their breastfeeding study day, having perhaps it come round every few years and they thought, oh, this again. And I felt really passionate about presenting the information in a different way and getting people that weren't so keen on supporting infant feeding like fired up and interested. And those that were already interested wanted to provide the gaps in their knowledge because they wanted more but didn't have access. So as a private practitioner, I then founded the Infant Feeding Academy, and I've made education available to doulas, midwives, health visitors, doctors, anyone with a passion really to increase their knowledge. And we do this through masterclasses and also to kind of main flagship programs that we teach. One is called the Infant Feeding Coach Program. And that's founded on coaching skills that puts the baby and the parents really at the center of the care. And I'm going to be talking a little bit about some of those coaching skills within my presentation as well, and sort of why that's slightly different to how feeding support has historically been, approached. And the other program we teach is about tongue tie assessing. So I don't teach, well, I can teach people to perform frenulotomy as well, but we normally do that within the NHS. But private practitioners, people who, particularly like health visitors, midwives that want to increase their skills, they will train with us to learn how to do oral assessments. But my passion is making sure that the oral assessment is done in context of the parents already having high quality feeding support first.
beautiful. I love that concept. You have that contest in there that, the parents are supported first and then go into this. I love also the aspect of coaching skills. I think this is very important. Our best assessment skills are great. If we don't have skills to, share that knowledge and share it with the parents, make the parents center stage, so to speak, because the baby is their baby and they are the experts, it is so important. So I'm really looking forward to this presentation. Now, you're specifically talking about the critical role of skilled feeding support, which is your passion, in tongue tie management. So tell me a little bit what we can expect to learn from you.
So I have some sort of frameworks and models that we use within the care that I provide that I want to go through and explain. I'm not going to teach how to use them specifically, but just how they fit in the context. And really sort of where the role of doing the oral assessment and the findings from the oral assessment, how they can play a part, if a frenulotomy perhaps is indicated, how that's going to play a part in supporting the feeding challenge, as opposed to being seen as the one stop, there's all these problems. I know we'll perform a tongue tie release, and then it, the parents either think it failed, it wasn't done properly, it wasn't done soon enough, it didn't work, because we're not looking at the feeding. So I have just had a family with me today, before this interview, who are still struggling at 9 weeks, and they've now come last hope, last stop to come and have the frenulum released. And I had to explain to them that maybe it's going to have an impact, maybe it's not, because everything where she's got to at 9 weeks has become very muddled and confused, and she's pumping some milk and giving it at a different time of day, and the baby's hungry all the time. And, so really it's about understanding what can be done in as skilled feeding support, rather than just jumping into thinking that a frenulotomy is going to fix everything.
Yeah, setting the parents up for success, that's what it sounds like to me, right? Because you're preparing the parents before. It sounds like me, you're working with the parents long before the frenotomy. In this case, is the last kind of the next step. But many parents go into this thinking the frenotomy is the solve all, right? Like we've seen it before. Maybe they read something on the internet or in moms groups or whatever, saying like if they heard of, oh, I got my baby was tongue tied, and soon as they were released, everything worked so much better. Maybe, but maybe not, right? So to work with parents to set them really up for success and not false hopes or expectations, knowing that, yes, maybe there is a big difference, but it might take a while, it might take work, it might take, because the baby has so compensated now for what's doing, it has to learn practically almost again to adjust to this as well. So has the parents as well. So what kind of strategies help you, with regards to communication? What helps you and what helped to work with the parents in that way?
So I'm always really looking at their feeding goals, and their goals from perhaps what they said antenatally. She's got used to saying, "Oh, I want to breastfeed." But actually, at 9 weeks, after 9 weeks of struggle, where are they now? And I think that's the difference really with these kind of coaching skills. It's basically meeting them where they are today during this consultation, and where do they want to be. And the other aspect of it really is, obviously what they want is a baby that sleeps well, feeds well, everything's beautiful, the house is tidy, the partner's helping, from this kind of chaos and challenging situation. And that isn't going to happen from the beginning of a consultation to the end of the consultation. We need to kind of create a bridge, an arc. So it's about goal setting for the parent, looking at what is the most important aspect of what we're going to look at today. What would success look like to that family? So often I think as health professionals, we think, right, okay, so what they want is they want to be able to breastfeed. And sometimes I've almost offered that solution, and then you see that hesitation, and it's like, oh, but I actually also want my partner to bottle feed. It's like, do you want to bottle feed, or are you bottle feeding because it's not going well? And it's about picking that out. And sometimes they don't really want you to fully fix the breastfeeding because that isn't their goal anymore.
Yes.
So it's the coaching skills that pick out what is the family's goal, and has that goal changed? And sometimes even has that goal changed from the beginning of the consultation to the end? What she walked in saying, this is what I want. Is that what they still want?
Absolutely. That is such a valid point, because that's something we often, not forget, but we still work with that original goal often that was brought to us, right? Like when the family first walked in, not realizing that, or maybe because they haven't voiced that, that their goals down the line have changed or slightly shifted or whatever it is, to really figure that out and really, with communication skills and coaching skills, as you mentioned, really ask the right questions and really adjust to their goals, even if their goals maybe differ from what we had hoped for them, right? When they originally walked in, the example you gave, oh yeah, I want breastfeeding, only exclusively breastfeeding, nothing else. And down the road, things have shifted, and now it's also on us to accept that, yeah, that's not the goal anymore, and that's okay. That's what the right thing for this family is this in that moment. So to really work with them and meet them where they're at, right?
And I think it's having that ability to sense when you're now, you can go off down this line, fixing what they said they wanted fixed, and then seeing that hesitation. I had someone recently that said the baby would only feed on one side with a nipple shield. And so I said, may I help you? And got rid of the nipple shield, and the baby latched on. And as soon as he did, I was excited. I had a student with me who was excited. Grandma was excited. Dad was excited. And mum looked a bit peeved. And I said, "Are you okay? He's feeding, he's latched on without a shield." "Yeah, but he always latches on that breast." And I was like, "Oh, I thought you said he doesn't latch on that breast without the shield." "Yeah, but," so I said, "Should we try the other side?" And we needed to make adjustments with him. And he then latched on the other side, but one he never latches on at all. And then she still didn't look happy. And then she kept saying to me, "Are you saying he doesn't have a tongue tie?" And what she wanted was to come in with this set of, he won't do this, he won't do that. Can you cut the frenulum? And then when I said, "Oh, well, let's look at the feeding then. Oh, look, he can do this, he can do that. Isn't that brilliant?" She wasn't pleased. So it was really interesting and then there's that unpicking of what is it you're needing, what is it you want. And obviously I would then never be able to perform a frenulotomy if there's no indication for it. But then we need to have a look at what's happening. How's mum feeling? Why does she want the intervention, but rather than having the feeding fixed?
Right.
So
Yeah. Very interesting. Yeah. Very interesting. And lots of work also with the subconscious, because I assume no parent or no mother walks in there thinking, do it, on purpose, not wanting things to go well, right? But they have, this preconceived thing that they thought it would be, and if things differ or deviate from the original plan, that might be difficult for them to integrate for themselves. It's not something that they did on purpose, but really working with them is really, again, where you mentioned coaching skills come in very handy, right? This is so fascinating, Dee. I could talk to you for hours here. But before I let you go, what is it that you hope, first of all, our viewers will take away from this presentation, and any final wise words you would like to share with us here at this moment?
Yeah, I mean, the main message from me, and I sort of said when I was asked to do this presentation that maybe I approach things slightly differently, is that we need to, people that are doing the referrals, people that are, peer supporters, doulas, midwife, people that have that kind of first point of contact, please don't see or not see, think that it's oral restriction and it's all about the referral. Even if there's a really obvious restriction, what can be put in place before they get to the tongue tie practitioner? Because we need to be thinking, what about protecting milk supply? What time can be spent on doing positioning and attachment, rather than waiting to see the tongue tie provider? You may not be somebody that can perform the frenulotomy yourself, but you can put everything in place, particularly if milk supply is an issue. Because if once they get to the tongue tie provider, milk supply is abundant, she learned everything she can about positioning and attachment, they're then able, and a frenulotomy is required, they're then, able to move forward really quickly. We don't want to be waiting for the procedure that may or may not go ahead and then have that as our starting point. So for me, it's to think, regardless of what you think is going on orally, go back to basics, protecting milk supply and looking at skin to skin and, baby being with the nursing parent.
Oh, I love that approach because, yes, really going back to basics and setting them up for success. Skin to skin, so important, right? Like there is so much we can do. And often when we see or we think there is a tongue tie, we go, oh, yeah, that's not my area of expertise. I can't do this. So, handing, over, we have to refer. That's right. But I love that approach that we are not as quote unquote helpless as we think we are as providers. We can really set them up, give them the good basics, and make sure that once they had that frenotomy, they're really then set up for success. Yeah, thank you so much. It was wonderful talking to you today, and I can't wait for your presentation and at the Tongue Tie Symposium here
Thank
with us
you.
at Gold.
Thank you.
And for our viewers, now some information. If you're interested in finding out more about this presentation and the rest of the Tongue Tie Symposium, we would love to invite you to go to goldtonguetie.com for more information. We also have a free keynote available on September 15th with Dr. Agarwal, and we hope to see you there at the symposium, of course, and at all the session of the symposium. Thank you all for watching and have a lovely rest of your day wherever you are in the world. Bye-bye.